Hi, I'm Dr.YVRao, plastic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. Today I'll be operating on a 22-year-old girl who has bilateral keloids on the ears. Keloid means it's nothing but an excessive scar tissue. Normally, whenever there is an injury, there will be some amount of scar tissue. It depends on whether it is a clean cut injury or a irregular lacerations or other contaminated injuries. If it's a clean cut and well sutured by a plastic surgeon, usually the scar tissue is minimal. On the contrary, if it's a contaminated or when the area is exposed or there is some infection, the scar tissue formation may be more. So this lady got some ear piercing done 2 years back, and since then she developed this excessive swellings on both sides of the ears, like in this zone. Why this keloid forms? Not all ear piercings produce keloid, only in some cases. So there are certain areas in the body. Likewise, there are certain individuals are prone. Keloid has a familial tendency. It can run in the families also. And the second, keloid has a other racial also predisposition, whereas blacks, that is those who are in the African or other subcontinents, they do have more keloids, excessive scar formation. So likewise, keloids have some predilection for the sides, ears, upper chest, back, and the tip of the nose. There can be some excessive formation of the scar, that is keloid formation. So areas wise, familial wise, and then even racial wise also there is a variation in these people. And same individual, if they develops or if he gets an injury in one side, and then he may not develop the keloid, but in the second time they may develop the keloid. So it depends on various factors. As I told you, it's a clean cut or irregular, how much of is exposed. So to tell you this one, I'll just why keloid forms. Normally skin has two layers, epidermis and dermis. Epidermis is hardly far less than 5%, and dermis is the one which is the white tissue color. And in all people, the dermis is white, whereas the epidermis, the color is different. In brown people, it is brown, whereas in whites, it is white. So the major part is dermis, that is 95% of it. So when the skin is cut totally, there will be less chance for fibroid or excessive scar formation if it is sutured properly, if the both edges are supported. But when the skin is cut partially, that is only the epidermis part, and leaving the dermis part, that is whitish part, more, that is which has more amount of collagen fibers, leading to other fibrous tissue, that is with nothing but hardening and then excessive scar formation. So incomplete tears or excessive exposure of the dermis, that whitish part, can lead to, because the collagen within the dermis, they get stimulated and produce uncontrollable scar, that is nothing but the keloid. So normally we don't, what is the treatment means? Usually surgery should not be done, or surgery should be the last choice in any keloid. Because any surgery, even after surgery also, there can be chance of recurrence or reoccurrence. First, we always try with conservative measures like injections. Injections, some amount of low dose steroid, that is called, we call it Kenacut, nothing but the compound name is triamcinolone acetonide, which ranges from 10 to 40 milligrams per ml concentration, and we can give easily once in a month, 3 weeks. And the only thing is it is avoided in pregnant ladies, and some other precautions have to be taken during the administration of the drug. And the other one is with repeated, how often can we give injections means usually you give once in 3 weeks, and this can be taken any number of times. With 1 or 2 injections, usually we see significant suppleness, that is the hard tissue becomes soft and then the raised tissue becomes flat. If it is enough, some people get good relief with these things, whereas some people may not get good relief, and then there may be reoccurrence, again it may proliferate. So we can keep on giving for some more times. The other option, if it is refractory even to this, or if it keeps on recurring, whatever, the other one is a form of 5-fluorouracil injections also we add, and then we give them in that one. It is nothing but an anti-malignant drug which is effective in controlling the fibrous tissue. Another form of treatment is low dose irradiation. Usually, as I mentioned initially, it is avoided in pregnant ladies, whereas it can be given in other normal individuals. And in this low dose irradiation, they try to suppress or kill some of the collagen fibers within the dermis, and then the keloid reduces in size. Some people may not be, because it is not so easily available, and many people get afraid because when we say radiation means for this small case, many people may not agree. So as a last resort, we try to give some amount of, that is, we remove them by surgical treatment. We're explaining 50-50 chances. That is, 50% there may not be any recurrence also, and 50% there may be chance of recurrence. And what we try is, when we do as a plastic surgeon, what we do is, when we try to when we remove the keloid, we immediately give some amount of Kenacort, that is triamcinolone acetonide, so that from the day zero, that is day zero, there will be suppression of the immunity or suppression of the collagen fibers to produce excessive fibrous tissue. So like this, we give it once in 3 weeks. That even after the operation, if we give a few times, most of the patients get good relief. As I told you, 50% there, in 50% there may be reoccurrence also. But which 50%, no one can tell. So one has to take a chance, especially when you are going for a surgery. So there are various modes of treatment for a keloid. Sometimes a less severe form called hypertrophic scar. Keloid means uncontrolled excessive scar formation. Hypertrophic means a little more than the normal scar tissue. In such cases, usually they subside with the amount of injections like triamcinolone acetonide or 5-fluorouracil most of the times. And they don't give that much of a problem. And with some creams also. So normal scars also, it is always better to, especially after the repair, after any surgery or after any trauma, we'll try to give some amount of silicone-based creams for about 3 to 6 months. And we use them to ask the patients to massage, because that also reduces the scar formation. So silicone creams, injections, low dose irradiation, and as a last mode of treatment, surgery. So these are various modes for keloid treatments.